There's a change growing over Uganda, the small country in the middle of East Africa. A change that is starting to make a difference, a big difference. It's changing lives and saving lives and ensuring Ugandan children have a future. Uganda has one of the highest death rates of children in the world. An estimated 140 out of 1,000 children die before their 5th birthday. That compares with 6 in every 1,000 in Canada. And in some rural areas of Uganda, the rates are even higher.
It happens that here in Uganda, there are a lot of preventable diseases that affect children. You may wonder about if 5 children were born, then at least 1 or 2 would die before the age of 5. And they die because of preventable diseases.
Preventable diseases like malaria, pneumonia, diarrhea, measles, meningitis, and complications during birth. HIV, AIDS, and malnutrition are common. Poverty is crippling. Families lack clean drinking water and electricity. Healthcare facilities are limited and many kilometers away from small rural communities. So the people here in the villages of southwestern Uganda have taken on the job with hopes of changing the statistics. They are volunteers with Healthy Child Uganda. Their main goal, to keep their children from dying. Their method, educating others in their communities on ways to improve the health of their children.
My dream is to see children growing and not being disturbed by preventable diseases. Educating a parent is educating the children.
Robert Bayamukama is one of the 185 volunteers trained so far in southwestern Uganda. He, like the others who proudly wear the blue T-shirt, was chosen democratically from his village. After 5 days of training by local health workers, he's ready to pass on what he's learned to mothers and fathers of young children.
These are people who come from the communities themselves volunteering. They volunteer their time, they volunteer their efforts because it is that they believe that their own communities should be better. And they are quite amazing people because they are willing to do this voluntary work.
Gad Rugaza is the coordinator of community-based health education for Mbarara University. On this day, he's joined the health workers and volunteers at Child Health Day. Mothers with children walk great distances from surrounding villages to get to this Child Health Day. Here, their children are immunized. The volunteers check their weight. They talk about ways to prevent the diseases that so often claim the lives of the children in their villages. Encouraging good nutrition using food that's already grown in their lush climate. How to boil drinking water so infants don't get diarrhea. Clearing the bushes to prevent malaria and explaining the importance of sleeping under a mosquito net. They also discuss how to prevent HIV/AIDS and its spread during childbirth. Talking about some solutions and healthy ways of doing things is making a big difference.
Measles used to be a very, very big problem. I remember in '85, in my own home, 4 children died of measles in only 1 month. But now those cases are very rare. So if we can eradicate the 8 killer diseases, that would be great.
Healthy Child Uganda is not there yet, but it is making an impact in the overall general health of many children in Uganda. Healthy Child Uganda was started in 2003 by local healthcare workers through Mbarara University. They asked the Canadian Pediatric Society for help. The University of Calgary and Dalhousie University also got involved. Dr. Jen Brenner is one of the pediatricians from Canada who answered the call. She's witnessed firsthand the difference Healthy Child Uganda is making.
I get the privilege to work with a really unique group of people, some very bright, motivated Ugandans who are really inspiring to me and truly have made a difference and make a difference every single day when they go out to the communities. So for me, it's exciting. It's exciting to see the change.
Dr. Janice Hurd, a pediatrician from Calgary, has also seen a change through the project. She volunteered at the University Hospital in Mbarara and in the community with the Healthy Child Uganda project. She says the volunteers with Healthy Child Uganda help the hospitals too by assessing which children need urgent medical attention before it's too late.
The children that would arrive at the Mbarara University Hospital were moribund, basically. They were on their last legs. We could save some of them, but it was not uncommon to admit 30 children overnight, and half of them would have died by morning, just because they were brought too late. And I think that the more villages where they have volunteers that are taught this, the fewer kids that'll come in such a desperate situation.
The volunteers with Healthy Child Uganda help in another major way as well. They show students from Mbarara University another side of medicine.
These are people who have been able to get school fees and to be able to pay for the tuition at the university. So it's like a learning experience for them also, to get down to the grassroots and appreciate for themselves.
Healthy Child Uganda wants to expand its project to more villages in the country. The project is run almost entirely by volunteers, so it doesn't cost much money. And those volunteers are incredibly resourceful. Expanding the project to connect more communities may be a daunting task, but the volunteers with Healthy Child Uganda have already proven it's not impossible.
The need is enormous. We need support to continue this. Together, we will succeed.
Amba